wait. Don't scroll it. I think you are missing something. If you scroll it, you will miss a big opportunity like Dhamakathar offer for the exam preparations. So GNM students, are you ready for your upcoming exam? Don't worry, we are easiness here and welcome you back in the Lakshya 3.0 series in our big sessions like exam preparation session. So let's start about today's sessions, and mainly we are discussing here today about the nursing foundation and first aid for the GNM first year. So don't go anywhere, sit quietly, keep calm and listen the classes. I hope you are going to crack the exam with a very good score. So don't scroll it, don't stop it, just listen. So let's start about today's session. So first, mainly in this session हम लोग जो important topic आता है nursing foundation के लिए वो भी discuss करेंगे, ठीक है? So first is the topic is concept of the nursing. So what is the nursing, why nursing is needed, and what is the main our role as a nurse, what is our role to provide a proper quality of care to the students. So let's start. First you see about the health. So what is the meaning of health? So we know that in the nursing profession, health is a concept. So in that they're mainly focusing on the promotion, prevention, curation as well as the preventions of the disease and the sickness, and also the delivering patient-centered care for improving our physical, for mental as well as for the social and spiritual health. So according to the WHO, health is nothing but it's a complete state of physical, mental and social well-being, and not merely the absence of disease or infirmity. So that is the definitions of health, right? We all know. So mainly the concept is nothing but it's a mainly focusing on the promotion, preventions as well as curations of any kind of the sickness, and to provide the proper quality of care to the patients. So now come to the nursing. So what is the concept of nursing? So nursing is nothing but it's based on the compassionate care, patient advocacy as well as a holistic approach. So holistic approach is nothing but it's a overall approach, means all our well-being is under the holistic approach. So it's also the focus on promotions of the health, manage the sickness and improve overall quality of the life, and also it helps to leading the life. So as a nurse we have the opportunity to heal the patient's mind, patient's body as well as patient's soul. So as a nurse we have to provide that much of quality of care to help them for healing from the inner side. Now come to the next, that is person. So in the nursing is defined as a provide person with a comprehensive care and the support which is mainly encouraging the health as well as the well-being by the physical, emotional as well as the psychological aid. Okay, now come to the next, that is environment. So what is the meaning of environment? So it's mainly comprises of all the internal as well as the external factor which is act on our human being for affect their behavior as well as the development. So now you can ask me the questions how the environment is related to our health, right? So if you belongs in the any unhygienic places, or if you are belonging in very much noisy area, so it will obviously affect your mental health. So when your mental health will be affected, so overall all your body will be also going to affect, because sound mind, sound body is equal to the healthy body, right? So that's why if your mind is affected through the environment, if you can't feel any peace as well as if you are not feeling comfortable, so obviously your mind is going to be distracted, and for that your whole body is going to be affected. So now move to the next, that is meaning of nursing, and that is the most important definitions for the upcoming exam. So that is the definitions of nursing. Okay, so the mainly the goal of our nursing profession is nothing but promotions of physical, mental as well as the emotional well-being of the people by providing them with a comprehensive care, support as well as the advocacy. So as a nurse, while we are delivering the care, sometimes we have to play a role as an advocate, sometimes we have to play a role as a teacher, and sometimes also we have to play a role as a collaborator. So different kind of the goals are having we have to play in the hospital settings. Okay, so mainly the improving health outcomes, which is include the assessment, intervention, as well as the education. So as a nurse, first while we are going to visit the students, first our role, the assessment of the patient, and it should be very clear, like subjective way as well as the objective way. Head to foot assessment is very much needed while we are observing or while we are going to deliver some treatment to the patients, and same way like intervention. So based on the disease conditions and based on the patient condition, we have to set some objectives, and based on that we also have to set some interventions, how we'll provide the care and what should be the rationale of that particular care supported. Okay, so based on that rationale we have to provide the interventions, means example wise, and based on that we have to provide the care. And education is nothing but like health education. So while we are going for the regular visit to the patients, as well as while we are going for giving the medications and all to the patients, so that time each and every shift we have to provide the health educations to the patient. It is so much mandatory in the hospital settings. Now come to the next, that is definition. So the unique functions of the nurse is to assist the individual, sick or well, in the performance of those activities that are contributing to the health, to its recovery or to the peaceful death, that he would perform unaided if he had the necessary strength, will or knowledge. So that is the definitions of a nursing, and this definition is given by the V. Henderson in the year of 1960. Let's move to the next slide, that is scope of nursing. So from our nursing profession, what are the scopes are there? Okay, as a nurse, what should be our role in the hospital settings? Okay, so see, mainly the utilizations of our nursing knowledge in the hospital settings is very much important. How you will have to utilize, that is by critical thinking procedure as well as by the judgment and by the skills. So critical thinking is needed especially in the emergency situation. Okay, how you handle it. Suppose one critical cases came and the doctors are not available in the round, so that time as a nurse you only have to take the responsibility as a leader to provide a proper quality of care. So for that you have to think critically how the treatment will be affected for the patients, and if you don't give this particular treatment to the patients, means what should be the effective on that. Okay, so take your own risk and go for it. So that is called critical thinking capacity. So during the emergency situation, obviously you have to improve, you have to utilize your critical thinking skills and judgment, in the sense like you should not judge any patients based on their culture, based on their thought and based on their value. You should do the judgment to the patients based on their disease conditions, means you could not do the prioritize for any patients. Okay, every patient is same for you. So that is the main goal or the main principles for a nurse. Okay, so adoptions of a holistic approach to care means overall care, which is mainly addressing the biological, psychological, social as well as the spiritual needs of a client. So promotions of a client's self-reliance and then self-determinations, which is actively involving the client partner in all the aspects of a care. Okay, so use of our nursing theories for define, organize as well as a nursing process for comprehensive care by the assessment, diagnosis, planning, implementation, evaluation as well as a documentation. So that is the part of a nursing process. So first process is the assessment. Then based on that we have to do the diagnosis. Based on that we have to set the goal. Then we have to do the interventions. Then we have to do the implementations, and last is evaluation as well as the documentations. Okay, so these are process of a steps are the nursing process. So now see the scope as a counselor. So sometimes we have a counselor, we have to play a role as a counselor, especially for the family members of a patient. So sometimes what is happening, they can't understand what is the treatment process is going on, what should be the next plan for that particular patients, for the healthcare workers. So by that time we have to play a role as a counselor to provide them as well as to guide them in a particular way. Now come to the collaborator. Collaborator is nothing but, suppose in one emergency case came and you are taking the responsibility to give medicine to that time to save the life of that particular patients. Okay, so at that moment you have to play a role as a collaborator with other colleagues, means with the other nursing personnel as well as the physician if the physicians are not present at that time. So you are the collaborator with other team members, not only the general physician, the specialty, as well as any other surgeon or other specialty also. Okay, so nurses, as a nurse, we have to play a role as a collaborator with the interconnections in other faculties also. Now come to that researchers. So suppose you are finding some difficulties because sometimes what is happening, like the like the patient's body is resisted for any kind of the antibiotics. Okay, sometimes their body is not responding on the treatment. So that time you have to take the collected data, and based on that you have to do the research, and you have to think why this process is not effective for that particular patients. So based on that you have to do the another procedure, right? So that is called as a researcher. Next is the leader. Sometimes you have to be a leader for the junior nurse as well as sometimes for the family members and the patients. Now come to the educator. Sometimes we have to educate the other nursing personnel, junior nurses, as well as sometimes the patient and family members about the particular treatment and then treatment process, etc. Then a manager, and next one is the caregiver. So these all the scope of a nursing profession. Now come to the next topic, that is nursing as a profession. That is the one of the most important questions for the upcoming exam. Explain the nursing as a profession, that is for the 5 marks. Okay, that is the most important question. So when it's called as a profession, so profession is nothing but it is an occupation, vocation, as well as a career where the specialized knowledge regarding this nursing profession of a subject, of a field or a science which is applied, means it should be scientifically proved, and the field you have a proper knowledge, okay, and it is should be usually applied to the occupations which is involve prolong the academic training. So for our nursing profession, why it's called as a profession? Because if you want to get a GNM nurses degree, so you have to go through the 3 years training process, right? If you want to get a BSc nursing degree certificate, so also you have to go a 4 years of the nursing training procedure, right? So that's why it's a prolonged academic training, and also there is a formal qualification certificate is there, and in the same particular field they will provide you so many knowledge about that, and they will teach you how to take care about the patients, and as well as in inner side of the hospital, outside of the hospital, in emergency situation or anywhere, right? So that's why the nursing profession is called as a profession. Okay, so see the qualities and then preparations of a nursing professional. First is love for the fellow man, means always as a nurse we have to become and we have to be very much sympathetic for the people who are surrounding of us. Next is the honesty and loyalty. If the patient doesn't want to declare her problem or his problem with the family members or with the others, so as a nurse we have to maintain that loyalty, and also we have to keep it in hide. Okay, and honesty. As a nurse you should be honest in your profession. You should not cheat the other persons, as well as you should not comparison the patients based on their values and thoughts and any like through the money. Okay, so next is the discipline as well as the obedience. Whenever you will come to the duty, it should be very much discipline wise, it should be very punctual. So as a nurse you have to be very much discipline and obedience. Alertness as well as intelligent observation. Through your eyes only you have to observe which patients is having problem. If the patient is having any issues like anxiety, or they're having any like conversation issues, so that time you have to be supported, right? So next is the dependability, adjustability. Next is ability to inspire the confidence of a nursing personnel as well as the patient and their family members. Then economy of a time, material as well as energy. Then sympathy and empathy. Next is intelligence as well as the common sense. You have to use your intelligence as well as your common sense for delivering the care. Next is patience and then sense of the humor. Then good physical as well as the mental health. Always you have to maintain first your physical and mental health, then only you will be able to give a proper care. Then gentleness as well as the quietness. So these all the qualities as well as the preparation. So now come to the next, that is ethics of nursing profession. That is also one of the most important topic. Okay, ethics of a nursing profession. So the code of ethics of our nursing profession is nothing but it's a set of the ethical principles for our nursing profession which should be accepted by all the members of our society as well as the all the members of our nursing profession. Okay, so what are the ethical principles? So first is accountability. Accountability in the sense ability to answer for one's own action. Next is the reasonability, means whenever you are doing something, obviously the one specific reason should be there behind of that. Okay, next one is the confidentiality. Confidentiality is nothing but not revealing the information about the patient to the third party. So if the patient doesn't want to share the information or share their data to the other person, so as a nurse you have to be so much confidential with that. Next is the autonomy, means right to make the one's own decision. So suppose in emergency situation no one is available, so you have to make your own decision, you have to take your own risk and you have to save the life. Next is the non-maleficence. It is duty to do not harm, means we should not be precise any patient based on their any other data, as well as we should not be follow any wrong procedure while giving the medications or any other procedure. Next is the beneficence, means the doing good. Always you have to be good with everyone, and justice means fairness. You have to be so much honest in your profession. And next one is the fidelity, means to be faithful to the agreements as well as the promises. And then veracity means refers to telling the truth. And next is the ICN or International Code of Nursing. Okay, so that code for the professional conduct. What is this? That is professional responsibility as well as the accountability. Next is the nursing practice, especially the procedure. Then communication as well as the interpersonal relationship. So as a nurse, while we are going for delivering the care, so first is a rapport, means how you will build the rapport through the communication, with the proper communication by maintaining the IPR or interpersonal relationship. Next is the valuing the human being. Next is the management. You have to manage each and every conditions, each and every each and every situations very calmly and very peacefully. Next is the professional advancement. Now come to the elements of a code of ICN. Okay, first is nurses and people. So what are the elements? First is primary professional responsibility for caring the people requiring the nursing care, and also the nurses holds in confidence personal information as well as the uses judgment in sharing this information. So that is all about nurses and people, means whenever you are going to deliver the the care, so that time always you have to keep it in mind that you should not deliver any message regarding the another patient to the particular people, or regarding the any other nursing staff to the people. Okay, so nurse, as a nurse you have to always maintain your dignity with the people. Now come to the nurses and practice. So that is the personal responsibility and accountability should be maintained as a ethics, and the nurse at all time maintain the standard of a professional conduct which will be reflect well on the professional as well as enhance the public communication and then confidence. Next is the nurses and then profession. So the major role of our nursing profession is nothing but determining as well as implementing the acceptable standard of the clinical nursing practice, management, research and then education. So the nurse, as a nurse, we have to be active in developing the core of research based professional knowledge. Now come to the last, that is nurses and then co-workers. So as a nurse we have to be always sustained in the cooperative relationship. So whenever you are going to take some decisions, obviously you have to discuss either priorly or the later with the other co-workers, and also you have to work as a collaborator with the other team members also. So the nurses, they have to take the proper action or the appropriate action for a safeguard individuals, their families and then communities when their health is endangered by a co-worker or in any other person. Now come to the next topic, that is hospital. That is also one of the important question for your upcoming exam, that is what is the meaning of hospital, definition of hospital as well as the types of hospital. So let's see, hospitals are nothing but it's a medical organization which is provide that a wide range of the healthcare service for the patients with a diverse medical conditions, and such as diagnostic, treatments, procedures as well well as a emergency care. So that is called as a hospital. So hospital is nothing but it is a like wide range of the healthcare system where it is going to delivery by maintaining a proper diagnosis, proper treatment, proper procedure as well as a emergency care. Okay, so see, now come to the types of hospitals. So what are the types of hospital? There are several types. So based on the services rendered, the routine care for the medical, surgical, gynecological, obstetrical as well as the pediatric. So based on that, based on the service, there are several hospital are there. Sometimes like gynecological hospital, then women and child health hospital, etc. Now come to the specialty. So based on the specialty, they are providing specialties such as maternal, then ophthalmology as well as the cancer. Now super specialty is nothing but it is a highly sophisticated diagnostic center, equipment, then therapeutic equipment, skilled staff, etc. So everything service you will be getting in the super specialty hospital. So as an example, cardiac surgery, neurosurgery, which is coexist in the same hospital. Now come to the based on bed strength. So based on bed strength, you will get three types of the hospital. Small hospital where you will get the less than 100 beds. Now come to the medium where you will get 100 to 300 beds, sometimes 500 beds, and large means more than 500 beds. Okay. Now come to the next, that is super specialty hospital. I said it is a highly sophisticated hospital. So now come to the based on funding body. So who is the founder for that particular hospital? Okay. So now come to the government. It is a grant received from central or the state. Then municipal means local self-government. Trust means charitable or any semi-charitable hospitals. They are charging moderate or the nominal charges to the patient. So that is the fundamental of that particular hospital. Next is the private, which are users pay for the each and every services. So when the users they are paying for each and every services to maintain this particular hospital as well as staff and any other obstacles. So that is called as a private hospital. Okay, so now come to the next topic, that is holistic nursing care. That is also one of the most important topic for your upcoming exam. So whatever the topic I have discussed now, so if you want to know very much detail and if you want to go to the depth of that particular topic, so obviously you keep it in mind, you have to download the Easiness application through the Play Store or through the App Store. If you don't download it, then you will miss the offer. Okay, so next about the holistic nursing care. So what is the meaning of holistic nursing care? Which is involving about the healing body, healing the mind as well as healing the soul of our patients. So mainly it's involving the thinking about our assisting patients with the physical, emotional, social, spiritual, religion as well as the personal relationship. So holistic is nothing but holistic nursing care or holistic nursing approach is nothing but when as a nurse we are taking care all over the like physical, mental as well as social and spiritual health of any patient. So that time it's called as a holistic nursing care. See the aspects of the holistic care. First is the physical aspect, means whenever we are taking care only about the physical state. Next is the emotional, mental, social as well as the spiritual. So these all the coverage of a holistic nursing care. So as a nurse we have the opportunity to heal the soul, heal the mind and as well as heal the heart and heal the health. So based on that we have to do the nursing care. Now come to the next, that is health. So what is the health? As I said, health is a state of complete physical, mental and social well-being and not merely the absence of any kind of disease or infirmity. So first we have to know what is the concept of health. So there are several concepts is there, like biomedical concept, ecological concept, psychological concept and holistic concept. So biomedical concept is nothing but when overall biology as well as the medical science is coming together and they are delivering the health as well as any other health systems. So that is called biomedical concept. Okay, so based on that, if your health is healthy, if your biology of your proper health, human anatomy, physiology, whatever, it should be healthy, then only you are considering as a healthy person. Now come to the ecological concept. So according to this ecological concept, if the human being is like developing in a proper ecological system, in proper healthy environment, so that time they will get a fresh proper elements of the living organisms, as example proper air, fuel, water, everything. So that time the patient patient, so that time the person will be considered as a healthy. Now come to the psychological concept. Psychological concept is nothing but sound mind is equal to sound body. So if you were proper healthy from your mentally, so that time you will be considered as a healthy person. And holistic concept is nothing but according to the concept, if your health is completely healthy physically, mentally, socially, spiritually, then only you will be considered as a healthy person. So these all the difference between biomedical, ecological, psychosocial as well as the holistic concept. Okay, now come to the determinants of the health. So determinants of the health is nothing but there are so determinants are there. Okay, first is the internal factor, so which is coming through the internally. So based on the internal factor and based on the external factors. So in the internal factor there are several factors are there. First is the developmental stage. So when you are growing up from your childhood, if you are not getting proper nutrition, if you are not getting proper care, or if you are not maintaining proper hygiene or toilet training or anything, whether you will be a healthy person? No, right? So that's why during the developmental stage you should be go through according to that, and then only you will be a healthy person. So that is the developmental stage. Next is the intellectual background, means a family background, family gene as well as family history, everything is related to that. Now is perception of a functioning, means how the body is functioning, how your mental, how your neurology, everything is functioning based on your behavior, which is moderate your thinking, which is moderate your thought as well as which is moderate your behavior. So that is the perception of a functioning. Now come to the emotional factor, how you are handling in a critical situation, either emotional way or in a strong way, whether you are so much emotional during the any critical situation or not. So these kind of things is maintaining by your own things, right? Internal things. So that's why it is under internal factor. Now come to the spiritual factor, means believe in God or believe in the spirituality. Now come to the external factor. So first is family practices. So in the family, how you are seeing how they are behaving, how they are practicing each and everything. So based on that you are understanding or you are learning, right? So that's why it's called as an external factor. Next is a socio-economic factor. So socio-economic factor is nothing but how you are engaging in the society, how they are how you are behaving with the society, and how you are getting the getting back of a response from the society, and how in which economic status you are belongs to. So these all the factors is contributing as a determinants of your health status, which will either improve your health as well as which will help to deteriorate your health. Next is the cultural background, from which culture you are belongs to. Based on your culture, your mind, your thought, everything will be growing up, right? So that's why cultural background is one of the most important thing for as a determinants of your health status. Now come to the basic human needs. So what is the basic human needs? Like Maslow hierarchy of a needs, its theory which is proposed by a Abraham Maslow in the year of 1943 as a psychologist. So the theory of the human motivation. So this theory is also known as a theory of a human motivation. Okay, so this theory they are suggesting the human needs which can be categorized into the hierarchical structure, with some needs which being more fundamental and then prioritized over the others. So that is called the basic human needs. So mainly these basic human needs or the Maslow hierarchical needs, these are considering in a so many structure, from the basic needs to the basic requirements to the up to the requirements. Okay, so mainly they are belonging as a safety, belongingness as well as the basic needs. Then under the basic needs there are several factors there, like clothing, then proper food, proper staying options, then body needs, everything. Okay, so these all are the options are there under the Maslow hierarchy needs. So now come to the next topic, and that is the most important topic for your exam, not only in theory but also in practical. So in this topic I am giving an overview of each and every positions. If you want to know in depth, you go to the application and check it. Okay, so mainly there are several therapeutic positions are there for giving the comfort as well as for providing the treatment, either medical or surgical. Okay, so let's see. First is supine position or the dorsal recommended positions. So in this we have to keep the patients in very flat way. Okay, so the patient's leg as well as the hand and body should be in a proper flat position. So that is called the supine as well as the dorsal recommended position. Now come to the Fowler's position. So Fowler's position is nothing but it is mainly helpful for the relaxations of the human spinal cord, and mainly it also helpful for the movement of the body, human body. Okay, so in this what is happening, the bed in front part means the head side part, they are raising. Okay, so that is called a Fowler position. Now come to the prone position. So prone position is nothing but mainly the patient, they are lying on the stomach. Okay, so the back portion should be in the front during the lying position, and the two hands should be in the beside of the head, as well as one leg should be raised in one pillow or any other side racks. Okay, so that is called a prone position. Now come to the lateral position. It's nothing but it's a side lying position. Now come to the next, that is Sims position. Sims position is nothing but 2 foot should be in a rest way, one hand should be in the back side and another one hand should be in the beside of the head. So that is called as a Sims position. Next is the lithotomy position. Lithotomy position is nothing but when from the buttocks till the legs, end part of the legs will be exaggerated. So that time it's called as a lithotomy position. So mainly this position is useful for the normal vaginal delivery. Okay, so there are several types of the like lithotomy position is there. That is low lithotomy, means normal way. One is high lithotomy where the legs is little bit raised compared to the normal, then exaggerated when the people exaggerating their hips area to the till the legs area until the hip area. Okay, so that time it's called as a exaggerated. And the final is nothing but completely when it is in high position and it should be with a support. So that time it's called as a high position. Okay, so these all are the basic types of a lithotomy position. Next is the knee chest position when the patient is lying in a very causative fact. When the patients, they are lying in a very close way and knee should come until the chest, so that is called knee chest position. Then a kidney position is nothing but when the should be lying in a 45-degree angle, and in that position the patient safety is needed, so that way we have to restrain the patient's each and every limbs. And next is the orthopedic position is nothing but with a cardiac bed type of support we have to positioning the patients where the patient's head should be lean down on the table. Okay, now come to the Trendelenburg position. Trendelenburg position is nothing but when the patient should be shifted into the parallel way, so head should be little bit down and leg should be in high position, so that is called Trendelenburg position. Now come to the comfort device. Comfort device is also one of the most important topic for the exam. Okay, so first is a backrest. Backrest is nothing but if the patient is a completely sitting position or any other position, so that time for providing the proper support to the spinal cord or to the back area, we are providing this backrest. Next is a knee rest. Suppose for the fracture patients or who are having any like ligamental issue and all, so for that, for the knee we are keeping this particular knee rest. Now come to the foot rest, means during the lying positions we are keeping this foot rest where the patients raise their legs and they can take the rest. Now come to the bed cradle. Bed cradle is mainly useful for the burn patient, otherwise for another patients for covering the lower portion. Okay, now come to the sandbag. So sandbags is nothing but it's a type of the cushion. Inside of that cushion sands is there, so for that it is using for like restrain the limbs, especially the knee area, from thigh to till the knee area. For restraining we are using the sandbags. It is mainly helpful for immobilize that particular patient. Next is the bed blocks. Bed blocks is nothing but is one kind of the device that which we are keeping either in the part of the head or else in the part of the foot for raising their head or the legs, especially for during any kind of the treatment or any kind of the medical or surgical procedure, especially if the patient is having any kind of the shock or we have to go for the postural drainage or any spinal anesthesia or any other procedure, so that time we are providing the bed blocks. Now come to the air cushion. So air cushion mainly we are providing to the patients as a neck support. So if the patient is feeling uncomfortable with the pillow and all, so that time for a proper prevent the immobilizations of the neck area, we are providing this air cushion. Next is rubber and then cotton rings. So rubber and cotton rings is nothing but it's mainly helpful for immobilize the bony premises. Okay, so in the bony premises we are using this, and we are preventing the pressure ulcer of this area, as well as it is helpful for influencing the circulation system in that particular area. So same way rubber ring mainly is using in the hip area, okay, hip and other surroundings area. And the cotton rings is nothing but when a rubber ring is wrapped with the cotton, and that time is called as a cotton ring. And mainly this cotton ring is using in a elbow as well as a heel area. Okay, so these all are the uses of rubber and cotton rings. Now is water and then air mattress. It's nothing but it's mainly using for the pressure ulcer patient, for mobilizing the patient easily, as well as it also helpful for the patients who all are having the structural issue of the spinal cord like kyphosis and all. So for those patients also we are using this air and water mattress, and also it is useful for the person who all are having the spondylitis issue and all. Okay, so now come to the next, that is back care. So back care is also one of the most important topics. So mainly who all are the patients and the bedridden, so for them back care is too much important for mobilizing as well as for circulations the blood on this particular back side. So it is helpful for like provoking this particular sore area, and it's also helpful to heal the sore area as well as sore ulcers. Okay, so see this, the back care means cleaning as well as the massaging the individual's back in a very therapeutic as well as through the comfort measures. Okay, so that is the definitions of a back care. So what are the purposes of the back care? So there are so many purposes are there. First is relieve the muscle tensions over the back side. So if the person is a bedridden in a proper longer way, so obviously there should be muscle tension because they can't move from here to there, right? So for that, for relieving the muscle tensions, we have to go for the back care. Next, we have to promote the physical as well as the mental relaxations of the patients. Then also it is helpful for relieving the insomnia. Insomnia is nothing but who can't sleep at the night time, who is having the sleeping issue. Next is stimulate the blood circulations over the back side. So what will happen? Like pressure ulcer as well as any other factors will be reduced. Then assess the conditions of a skin. Okay, now come to the next, that is bed making. So bed making is also one of the most important for the upcoming exam. So bed making is nothing but it's a process of making the bed for the patients for and a clean and free of the wrinkles for the comfort for the client. Okay, so what are the purposes of the bed making? There are so many purposes, like economize the time, material as well as effort, to educate and the relatives to care for the sick at home, provide the comfort, sleep as well as the rest to the person, maintain the clean and the neat appearance to the unit, so it will look so calm and the patient is also not feeling any fear or anxiety. So giving the proper look of the unit, bed making is too much important. Next is reduce the transmission of a microorganism from the bed to the patient. Next, establish the effective nurse-patient relationship and to ambulate the patient. So now come to the basic principles. First, before and after bed making, we have to go for the medical hand wash at least. Okay. Next, when we are removing the sheets, so that time we have to leave the bed or leave the mattress while loosening the bed linen. Okay. Next, always fold the bed linen from top to bottom. We have to fold. So what will happen? Like if you fold the linen from bottom to top, so dust will dust will overflow on the mattress. Okay. So for that we have to fold the linen from top to bottom. So the dust also will be folded with the proper folding from top to bottom side. Next one is the turn the mattress from top to bottom when the bed is unoccupied. During the unoccupied only we have to turn the mattress. Next, always arrange the bed linen in the correct order and it should not touch the floor. Keep the open end of the pillow always away from the entrance of the ward. Next is the soiled linen should be kept in a dirty linen bag, and it is like a yellow colored bag. Okay, and when making the occupied bed, make sure no discomfort is caused to the client. Last is maintain the good body mechanism while doing the bed making. So these all are the basic principles for the bed making. Now come to the types of bed. So there are so many types are there. First is simple beds, and next one is the under the simple bed there are several bed: closed bed, open bed, and occupied bed. So first we have to know what is the meaning of a closed bed. Closed bed is nothing but whatever materials is needed for the bed making. As example, sheet, Macintosh, linen, everything is ready, and for preventions the dart as well as any for maintaining the cleanliness, one more sheet they are spreading over the bed, okay, for using of the client for the next client, okay. So that's why it's called as a closed bed. Next is the open bed. Open bed is nothing but except the linen everything is ready, means bottom linen as well as the Macintosh, everything is ready, but top linen they are keeping and folding over the pillow. So that is called open bed. And next is the occupied bed is nothing but always it is booked for one patient, and before the time of arrival we are occupied, we are making this bed, and then and there we are delivering that bed to that particular patient. So that is called occupied bed, okay. Now come to the special bed. So under this so many is there. Operation bed means operation theater bed. Next is the cardiac bed. Cardiac bed is nothing but like one cardiac type of the table we are providing to the patients along with bed. Next is a blanket bed, which bed is completely covered through the blanket. Next is the amputation bed. Amputation is nothing but removing in one or any part of our body, especially in the limb, so that is called amputation. So for that any other specialized bed is there, so for that the amputated patient will feel the relaxed. Next is the fracture bed. So for the fractured patients, especially the limb fracture as well as hand or legs, whatever, so for that one separate type of bed is there with a proper restraint. So it will help them to prevent the immobilization as well as also it will help to give the relaxation. Next is the burns bed. So for the burn patient, one is separate bed is there, specialist type of the bed is there with a proper bed cradle, okay. So that is the burn bed. Now come to the safety device. So what are the safety device? First is a restraint. So restraint is nothing but it is a physical device which is used for limit a patient's movement. Next one is the types. What are the types are there? Like side rails. So side rails is nothing but it's aids in turning as well as a repositioning. So it's mainly providing the hand hold to get in or out of the bed and comfort and security, and also it reduces risk of falling when transported. So these are the images of the side rails, okay. Now come to the next, that is soft restraint. Soft restraint is nothing but the resistance is used to limit the movement of a patient who are confused as well as disoriented, and the goal is nothing but prevention the patient from injuring him or herself. So that is the soft restraint, means especially the psycho patients or who are mentally established. So for those we are using the soft restraint. Restrain their limbs, okay. So now come to the next, that is limb restraint. Limb restraint is nothing but only it's useful for restraining the limbs, like only hand as well as only legs, to remove the IV lines, indwelling catheters and the nasogastric tube. So for them we are using this limb restraint. Now come to the waist and belt restraint is nothing but it is a full movement of the body. The restraining of the hands and legs are also permitted and used to prevent the patient from falling from bed or a chair. Now come to the splints. Splints is nothing but it is a medical device which is mainly help to immobilize and support the broken bone, sprained or the strained joint and wounded the soft tissue. So mainly in the kneecap as well as the handcuff. So everything is under splints. Now come to the nasogastric tube feeding. So nasogastric tube feeding is nothing but who are having the gastrointestinal disorder or who are having the liver problems or who gone for the any surgery, gastrointestinal surgery. So for them, for giving a proper medications or proper food based on the diet chart, sometimes we are providing this nasogastric tube feeding. So through the nose we are providing the Ryle's tube until the stomach by proper measuring the length, and after that through the proper 25 ml cc syringe syringe, we are providing that liquid food through this particular tube. So that is called nasogastric tube feeding. Okay, so it is the insertions of a tube into the esophagus and the stomach through the nose. So what is the indications? First indication, if the patient is unable to digest, chew or the swallow food. If the person is having any oral disease or the oral cancer or any other problem in the mouth, so that time we are going for the like NG tube feeding. If the patient is too weak or to swallow the food, when the patient is unable to retain food, next is surgery of the mouth, next indication paralysis of the face or the throat, and next one is the fracture of a jaw, and next one is the for a patient who refuses the food. So these all are about indications. Okay, now come to the contraindications. So in which time we can't provide the nasogastric tube feeding. Okay, first is gastric surgery. If the patient is gone for any kind of the liver surgery or any kind of the gastrointestinal tract surgery, so at that time, or the esophagus surgery, at that time we can't provide the NG tube feeding. Now come to the ulcer. If the patient is having ulcer in the stomach or any esophagus or any other GI part, so that time also we can't go, because if you go to the rice tube feeding, so it will directly hitting the way and where the ulcer is present, and it will be causing factor for the burning sensation of the patient. Now come to the tracheoesophageal fistula, means trachea and esophagus, if it is fissed and if it is creating as a fistula like structure, so at that time also we can't go, because the tube will only not going to reach to the stomach and it will be creating as an infection. Now come to the esophageal surgery. Polyps in nose. If your nose a polyps is there, so we can't insert the tube. If you insert very gradually or forcefully through the polyps, so it will be harmful on the polyps and it is also leading causing factor for the infection. Next is deviated nasal septum and then severe fracture. So what are the procedure? First procedure, we have to wash the hands and we have to clean the nostrils with a cotton tip solutions in a saline. Then we have to take the rice tube. Then we have to lubricate in the one end 6 to 8 inches with a thin coat of the water soluble jelly, sometimes glycerin or sometimes liquid paraffin. Next we have to hold the tube coil and we have to gently pass the tube backwards and downwards into the nasopharynx. How we were inserting? First you have to take the measurement from nose to the earlobes. Okay, after that from earlobes to the stomach. So until that we have to move the tube. Okay, so first we have to put the downward, then we have to put the first we have to put the tube in backward, then we have to put the in downward. Okay, so first we have to take the measurement from nose to ears, then only earlobe to stomach, and that inch only, that much size only we can provide the patient. Okay, that much inch of that particular tube only we have to use. So now come to the allow the client to take a sips of water, advance tube 3 to 4 inches each time. So check the placement of the tube in a stomach, aspirate the gastric content with a syringe. How we will check it? Through the stethoscope. We have to put the stethoscope and we can listen any sound, kind of the sound, which if it is exactly placed. How you get the sound? We have to give a proper gastric content for the aspirations like saline or syringe or anything. So for that we can get a sound, and based on that we can confirmation the position. After the tube is placed, that time we have to fix it with a side of the face and wait for some time before giving the feed. So these are the procedure steps for the nasogastric tube feeding, and also we have to know that before the feed we have to pour some water, then only we can give the feed. We have to follow the medicine and finish with a amount of water and clamp the tube in order to prevent the leakage of fluid. Okay, now come to the next, that is aftercare of the client. So after providing the proper NG tube feeding, what should be your care? We have to provide a proper mouthwash, we have to clean the face and dry, then we have to position the client in very comfortable way. In case of an unconscious patient, we have to apply the suction. If the secretion is collected in the mouth, then we have to discard the waste and clean and replace the articles in a proper place. Then we have to wash hands and record the time, amount of feed also we have to document it, and the reactions of the client if it is any present, so that also we have to take it, and as well as intake and output of the client also we have to check it. Now come to the nature of infection. So what is infection? Infection is nothing but one kind of the like microorganism, and based on that, when our immune system is not ready to fight with that particular microorganism, so that time it's leading causing factor of our infection, and that is also weaken our immune system, right? So that is the definition of infection. So mainly in this infections there are several types out there. Okay, first is microorganism, when uses the client's body for sustain itself, reproduce as well as colonize, and they are called the pathogen. As example, bacteria, virus and fungi. If it is enters through the nasal septum or any other way into the body, so there only they will reproduce more, they will colonize itself, as well as they will create a proper disease conditions based on their character. Next is that this includes the skin contact, bodily fluids, and contact with the faces, airborne particles, and touching an object which is an infected person is used. Okay. Next one is the immune system is an effective barrier against the infectious agent, but the colonize of the pathogen, it might be grow too large for the immune system to fight. Next is some infections mild as well as a barely noticeable, but others are severe and life-threatening way. Now come to the chain of infection. So what is the chain of infection? First is infectious agent. Suppose the tuberculosis. For the tuberculosis, the bacteria which is mainly responsible for creating the tuberculosis means tuberculi, right? So that bacteria as an infectious agent. Now come to the reservoir. Reservoir is nothing but how it's coming. So one tuberculosis patient is there, through the sneezing of that particular patient or through the touching the object of that particular patient, we are getting that microorganism. Now come to the portal of entry, portal of exit, how it's coming from the infected person, either sneezing or either coughing, etc. Mode of transmission. So when this infected person is sneezing or coughing, we are inhaling their air. So that is called mode of transmission. So through the nasal way it's coming into our body. Now come to the portal of entry. So through the nasal way it's coming into our lungs, and then only it's creating a problem. Next is susceptible host. Each and every adult age as well as the people, they are as a susceptible host. So susceptible host is nothing but in which body it's happening. So these all are the chain of infection. Now come to the defense mechanism. So what is the defense mechanism? It is a state of the responsiveness for the foreign substance such as microorganism and then tremors. So what are the functions of a defense mechanism? First is defense is nothing but it's protect the body against the invasions of microorganism. Hemostasis, cellular substance which are the digested as well as the removed, and then surveillance is nothing but mutation which is continuously arise in the body but normally recognized as foreign cells as well as the destroyed. So these all are the functions of a defense mechanism. So defense, hemostasis as well as the surveillance. Defense is nothing but when our body is completely protecting against the invasions of microorganism. Next is the hemostasis, means cellular substance which all are the digested as well as the removed, and surveillance when mutation is completely arise in the body but normally recognized as a foreign cells as well as the destroyed. So that time it's called as a surveillance. Now come to the types of a defense mechanism. So there are several types are there, active as well as a passive. So in the active way, active natural as well as the active artificial. So when our body is completely doing the mechanism against on the against on the microorganism, so that is called active natural. And next one is the active artificial. So active artificial is nothing but when our body, we are providing some artificial things like any medicines or anything, so that time the body started to work. So that is called active artificial. Next is the passive. Passive is nothing but passive natural. So when our body started to act as a passive way, in a natural way, so that time is called as a passive natural. And passive artificial is nothing but when the body, we are providing something and we are also provoking our body to active the like working as a passively and through the artificial way. So that time is called as a passive artificial. So these all are the types of a defense mechanism. Now come to the nosocomial infection or the hospital acquired infection. So what is this? It is a developing when the patient is staying at a healthcare facility and was not present when the patient was admitted to the facility. Okay, so when they are coming for the admission, so that time only they get this infection. So that is called as nosocomial infection. So most nosocomial infection, it is transmitted by the healthcare personnel, means from the nurses or from the doctors the patients are getting. Now come to the next, that is hospitalized clients. They are at the risk of such infections because the environment provide exposure for a variety of the microorganism that client has not been exposed in the past. Means now only they are exposing this kind of the microorganism, but previously they are not at all suffer for this particular microorganism. So that is the characteristics as well as definitions of a nosocomial infection. Now come to the asepsis. So what is the asepsis? Means infection is nothing but absence of a disease producing microorganism, and this asepsis technique is nothing but this is an effort for keeping the client as free from exposure to infection causing the pathogen as a possible. So what is the definition? So asepsis technique is nothing but it is an effort which is taken to keep the patient as free from any microorganism as much as possible. So what are the types? Medical asepsis as well as the surgical asepsis. So medical asepsis is nothing but when the medical procedure or medical technique they are taking as an effort for keep the patient as free from hospital microorganism. And surgical asepsis is nothing but when the surgery, through the surgery method, we are keeping the patients free from the microorganism. So that time is called as a surgical asepsis. Now come to the precautions or isolation precautions. So what is this? It is a barrier that create a barrier between people as well as the infectious agent. Means through this particular infection like protective agent, we are like preventing the disease or preventing the microorganism to enter in our body. So see, first is standard precautions. Standard precautions is nothing but like minimal way. Sometimes the hand sanitizer, sometimes using the mask. So these all are the standard precautions. Now come to the transmission based precautions. So for the specific diseases, transmission based in the sense like gloves, wearing gowns, wearing head mask as well as wearing the nose masks. Next is the airborne precautions. So for the airborne precautions, nothing, only hand sanitizer as well as we can use the face mask. Now is a contact precaution. So contact precaution, obviously always the hand gloves as well as the gowning, and then droplet precautions, always the face mask, okay, as well as hand sanitizer and hand gloves also sometimes we can use. So these all are the isolation precautions. Now come to the hand washing. So what is the hand washing? It's nothing but it's an act of cleaning your hands with a soap and water for remove the dirt, germs as well as in potential harmful substance. So first is medical hand washing. What is this? It involves the rigorously as well as the thoroughly scrubbing hands with a soap and then water, and is also many germs as a possible we have to remove. So the duration is into 4 to 60 seconds. Okay, so what is the procedure? First we have to wet our hands, then we have to take the soap, then we have to apply the soap palm to palm, then back of the hands also we have to apply. Next one is we have to apply the soap by rotating way into our thumbs, then we have to rotating this soap into our fingers as interlocking way, then we have to wash our wrist from tip the finger to the till the wrist, okay, rotation wise. Next we have to use clean our finger lengths as a clockwise and anti-clockwise, then we have to rinse our hands properly, then we have to dry the hands with a proper wet towel, then we have to use the towel to turn off the faucet as well as we have to use the towel to open a door to again that contaminations, to against the contaminations, okay. So these all are the procedure. Now come to the surgical hand washing. So this is nothing but it is a very thorough as well as systematic cleaning of the hands, which is using the antiseptic solutions before the surgical procedure. So its mainly duration is 3 to 5 minutes. So what is the procedure? So we have to put the approximately 5 ml of the alcohol abused hand rub in the palm using the elbow of the other hand. Okay. After that, we have to dip the fingertips of the right hand into the hand rub for the decontaminated under the nails. Next, we have to smear the hand rub on the right forearm up to the elbow. Next one is we have to ensure that whole skin area by using the circular movements. It should be clean around the forearm, and repeat the same procedure for the left hand and forearm, and you perform the medical hand washing procedure for the hands for around 60 seconds. So surgical hand washing is equal to surgical hand washing plus medical hand washing. Okay, so it is a duration is 60 seconds, and mainly this duration is 3 to 5 minutes, and for the medical hand washing 40 to 60 seconds. Okay, so mainly the surgical hand washing we have to wash in the same method way like a medical hand washing from tip of the nail to the elbow, but for the medical hand washing tip of the nail to the wrist. Okay, so that is the difference. Now come to the next, that is once hand should be dry, we have to sterile the surgical clothing and as well as the gloves can be worn. Now come to the next, that is gowning procedure. What is the gowning procedure? So dry and one hand and arm, then we have to start the hand and ending the elbow with one end of the towel. So dry the other hand and arm with opposite end of the towel, drop the towel. Means it is the after hand washing we have to follow this step. After that we have to pick up the gown in such a manner that the hands touch only the inside part of the gown, neck and shoulder area, but outside part it should not be touched. Allow the gown to unfold downwards in front of you. How you have to unfold? First you have to pick it up, then only through the non-dominant hand you have to unfold it. Okay, after that we have to locate the armhole, place both the hands in the sleeves. So we have to place our both sleeves to the gowning hand, then we have to hold our arms like that interconnected way slightly up as you slip your arms into the sleeves. Now we have to take the assistant for the another person, and we have to tell them to pull your gown onto you as you extend your hands to the gown cuffs. After that they will tie into the back side. Now come to the gloving procedure. So first we have to pick up one glove by the cuff using your thumb and index. So like that way a surgical glove should be there. Okay, so after hand washing through the dominant hand we have to pick it up by keeping your finger into that folded part. Okay, after that through the other hand we have to touching only the cuff, pull the cuff onto the one hand and encode the cuff over your thumb. After that we have to slip your glove fingers under the cuff of the another glove and pull the glove over your fingers and hand using a stretching side to side motions. Means after putting your fingers into the cover area we have to pull the gloves. Okay, you just remind your fingers should be touch only the inside part as well as the folded part, not the outside part. After completion of one finger or one hand, again you have to go for the dominant hand, and in that case you can use the non-dominant hand by touching the outside part. So it is easy for the dominant hand. Okay, so you can take the outside part of the dominant hand gloves and they can pull your fingers. Okay, next encode the cuff of your thumb and with your fingers still under the cuff, then you have to pull the cuff off and away from your hand and over the knit cuff. Then repeat, we have to proceed it till the glove to the other hand. So now come to the biomedical waste management. This is also one of the most important topic for the segregation, collection, treatment, transportation and disposal of the hospital waste. So it is a part of a hospital hygiene, infection control and maintenance activities. So these all are the categories. First is category number 1 under the human anatomical waste, category number 2 animal waste, category number 3 microbiology biotechnology waste, category number 4 that is waste starved, category number 5 that is discarded medicine or cytotoxic drug, category number 6 that is solid waste, and then soil waste, and category number 7 that is solid waste, category number 8 liquid waste, number 9 that is incineration ash, and then number 10 chemical waste. So these all are the categories of biomedical waste management. So first is segregation of the waste. It's nothing but it should be done at the site of the generations of the waste like patient care activity area, diagnostic service area, operation theatre, labor room and treatment rooms. So it's the duty of the waste generators like doctor, nurses, technician and other healthcare givers. So now come to the collection of the waste. So collection bag must be label as per the guidelines with a non-washable prominently visible labels, and then trolleys must be used to collect hospital waste without any leakage or the spillage of the trolleys must be transported. Then the separate containers with different colored plastic we have to take, and at every point of the segregation must be kept for the waste disposable as well as the collection. The color bag should be replaced. Garbage bins must be cleaned with a disinfectant regularly. Now come to the storage. So it's mainly involving the holding the waste of a certain period of the time at the site of generation till the gets treated as well as the disposed. So no, the untreated waste is stored beyond a period of 48 hours. If stored above the 48 hours, then it requires the permissions from the prescribed authority. So now come to the transportation of the hospital waste. How? Within the hospital, we have to avoid the passage of the waste through patient care area, separate the time schedule for transport of waste, dedicate the filled container, trolleys or the carts with the proper label, and trolleys or the carts clean and disinfectant in the event of any spoilage. Now come to the disposable outside of the hospital. So for that, we have to throw the vehicles specifically constructed for the purpose, having fully enclosed body linen like entirely with a stainless steel or the aluminium for provide a smooth surface which can be cleaned. Then the driver's compartment separate from the load compartment, and the load compartment provided with a roof vents for the ventilation. Now treatment. So liquid waste must be treated using 1 part bleach and 9 parts contaminated liquid. So lay stand for the 20 to 30 minutes. After treating, dispose down the drains with a lots of water. So color coding, yellow plastic bags, which is the waste category 1, 2, 3 and 6. So treatment options is nothing but incineration. For the red, like disinfectant container or the plastic bag 3, 6 and 7. So the treatment options is nothing but autoclaving, microwaving, etc. Then the blue and white, that is the plastic bags only, are the puncture proof container. Okay, so waste category 4 and 7. So for that, treatment procedure autoclaving, microwaving as well as chemical treatment. And for the black, only the plastic bag, and the category is 5, 9 and the 10. So for the disposable in secure landfill. So now come to the oxygen administration. So nothing but nursing action is nothing but we have to first check the vital signs, level of consciousness, almost recent the ABG. Then rational is nothing but we have to give a baseline for further assessment, nasal cannula oxygen administration. Then we have to assess the risk for CO2 retention with oxygen administration. Then you also have to check the PaC2 level for decrease and normal, and patient who should be experiencing the CO2 retention. Then we have to show the nasal cannula to the patient for explain the procedure. Then we have to make sure the humidifier should be used for appropriate mask, and humidification is not ordered if the low rate is less than 4 liter per minute. Then we have to attach the connecting tube with that particular mask. Then we have to set the flow rate it prescribed liter per minute based on that patient condition. Then we have to place the tips of the cannula into the patient nose. Then we have to adjust the straps about the ears for the comfortable fit. Next, read the flow rate as well as immediate patient response. Then we have to assess the patient's consciousness, ABG as well as functioning of the equipment. Then we have to determine the patient comfort with the oxygen use. So after care, what we have to do? We have to keep the patient warm and comfortable, see the patient progress by observing the vitals, arrange the ABG. Then when oxygen should be disconnected, then we have to turn off the regulator, disconnect the catheter. Then we have to clean the catheter, boil for 3 to 5 minutes for the next use, and all the articles should be cleaned, dried and replaced. Now come to the, we have to record the time oxygen, how much time it was started, overflow rate, method of administration, etc. Then we have to record the patient response for the inhalation, record the time oxygenation was discontinued. So now come to the hazards. What are the hazards of oxygen administration? Infection, combustion, oxygen toxicity as well as the atelectasis. Now come to the hypothermia. So hypothermia is nothing but it is defined as a body temperature greater than 37.5 to 38.5 degrees Celsius. So for that, what is the assessment? We have to monitor the oral temperature every 4 hours. Then we have to monitor the auxiliary temperature 97.6 degree Fahrenheit. Then we have to rectal temperature around 99.6 degree Fahrenheit, and we have to digital temperature measurement also we have to go. Now come to the management. So first we have to increase the intake of water, use of the cool blanket, avoid the heat environment, spoiling of the head, neck, trunk with a cold water. Then we have to switch on fan or the air conditioner. We have to administer the oxygen, IV fluids, monitor the vitals, ECG, etc. And we have to also administer the antipyretic drugs like paracetamol. Now come to the hypothermia, when the body temperature is less than 95 degree Fahrenheit to 35 degree Celsius. So that time it's considered as a hypothermia. It's nothing but when body is started to losing the heat. So mild hypothermia is nothing but 93.2 degree to 98.6 degree Fahrenheit, have shivering, lethargy, then rational to the rational behavior, etc. Then profound hypothermia is nothing but temperature less than 86.5 degree Fahrenheit or 30 degree Celsius, which make persons appear dead. So what is the assessment of the hypothermia? Monitoring the oral temperature every 4 hours, then monitoring the auxiliary temperature, assessing the rectal temperature as well as digital temperature management. Now come to the management. So first we have to remove from the cold environment, manage and maintain the ABG values or the arterial blood gas values. We have to provide the high flow oxygen administration. Next we have to go for the apply heat device. Then keep the patient's head covered with a warm dry towels as well as a stocking cap for limit the loss of heat, and the patient gently to avoid increase the cardiac irritability, and correcting the dehydration. Core temperature should be detached. Now come to the fluid replacement therapy. So for that we have to replace the abnormal fluid and electrolyte losses, maintenance of the daily fluid and electrolyte needs. We have to correction the fluid disorders as well as electrolyte disorders. So what are the types of solution? Isotonic. So in that 0.9% sodium chloride should be there and lactate ringer solution is there. In hypotonic 5% dextrose and water, then 0.545% sodium chloride and 0.33% sodium chloride. Now come to the hypertonic. So in that 3% sodium chloride solution you will get and protein solution, and in the colloid you will get dextrose, albumin as well as the gelatin. So now come to the difference between hypervolemia and hypovolemia. So hypervolemia is nothing but when body fluid volume will be increased in the body, and hypovolemia when fluid volume will be reduced in our body. So for if the fluid volume is decreased, so for that cardiovascular system will be affected, decrease the pulse rate, reduce the pulse, decrease the blood pressure, flat neck, hands pain, then decrease the central nervous system pressure, dysrhythmia you can see, and if it is increased means bouncing, then increase the pulse rate, elevated blood pressure, descended neck as well as hand pains, then elevated central venous pressure, dysrhythmia. Now come to the respiratory system. So for that if it is increased means increased rate and depth of the respiration, dyspnea, and if it is decreased means increase the respiratory rate, dyspnea, moist crackles or the auscultation. Now come to the neuromuscular system. So in that you can see in the decreased level like lethargy, coma, fever, depending on the amount of fluid loss, skeletal muscle weakness as well as the decreased CNS activity, and if it is increased, so in that case you will see altered level of the consciousness, completely headache, visual disturbance, skeletal muscle weakness as well as the paresthesia. And in the renal system if it is decreased means you can see the decreased urine output, and in the increased case you will get the increased urine output you can check. Now come to the sensorium. Sensorium is nothing but it's a completely coma stage. It is a state where the patient is totally unaware for both self and external surroundings, unable to respond meaningfully for the external stimuli. So what is the assessment? It is a Glasgow-Coma scale. So there are 3 parts are there: eye opening, verbal response and then motor response. So in the eye opening if it is spontaneous then grade should be 4, to the sound for the 3, if it is responding only for the pressure that time it will be considered as a 2, and if it is not at the responding then 1. Then for the verbal response if it is completely oriented then rating should be 5, if it is completely confused then rating should be 4, if it is responding only for the words then rating should be 3, if it is responding only for the sound then rating should be 2, and for the none of this means 1. Now come to the motor response. So in that if it is completely commending the obese, so that time it is 6, localizing means only 5, then normal flexion means only 4, and abnormal flexion of your any limbs and in the joints, so that time it is B3, and the extension means only 2, and none of them means 1. So mainly for the Glasgow-Coma scale we can consider based on the ratings. Okay, if it is mild means 13 to 15. So 13 to 15 like score is indicated as a mild unconsciousness. Moderate means 9 to 12 and severe means 3 to 8. So if the score is below 7, that time we can consider the patient is in coma stage. Now come to the management of unconscious patient. So for the respiratory system we have to position in semipolar position. Then oropharyngeal airway we have to manage for preventing the tongue from falling back and obstruction. Then endotracheal tube intubation we have to do every 4 hourly. We have to suctioning for remove the secretion, and we have to monitor the oxygen saturation. The neurological system, for that we have to administer the anticonvulsive drugs, then mannitol to reduce the cerebral edema. For the cardiovascular system we have to monitor the vital signs continuously. We have to monitor the cardiac arrhythmias, rhythms as well as monitor intake and output chart, regulating the IV fluids, regulating the heart sound, and administering the cardiac drugs, as example propranolol. Now come to the musculoskeletal system. So for for that we have to passive range of motion exercise to strengthen the muscles. Then we have to turning the schedule for every 2 hours once changing positions, and truck and roll we have to use for at the hip to prevent the external rotation. Integumentary system, for that we have to pressure range by changing position. We have to maintain the good skin hygiene. Emerald means applied to the dry skin. Early mobility we have to do. Then turning the schedule every 2 hours once changing position. Pillows can be used under the lower extremities for reducing the pressure. Then urinary system is nothing but long-term use of indwelling catheter, catheter care to prevent urinary tract infection, adequate fluid administering, monitoring the output chart. And for the gastrointestinal system, we have to monitor the intake output chart. Every 4 hours we have to give the tube feeding as well as the stool softener, and other management, sponge baths, pressure caregiver, then care of the mouth, eye, skin, and then physiotherapy also we have to protect for providing the muscles and the joint protection, and nutrition and fluid balance we have to maintain, and infection control. So now come to the care of patient with a pain. So for that it is the unpleasant sensory as well as the emotional experience which is mainly arising for the actual as well as potential tissue damage. So it's given by the International Association the study of pain, and unpleasant sensation and emotional response to that sensation which is given by the American Academy of Pain Medicine. So what are the types based on the expected recovery, like acute pain, chronic pain. Acute pain means it is a very slow and sudden onset, and chronic means it is a very prolonged as well as recurring. Now come to the based on origin of pain. Cutaneous pain which is originate in the skin or subcutaneous tissue. Deep stomatic pains which is originate in the ligament, tendon, bones, blood vessels and nerves, etc. And next is a visceral pain which is mainly resulting from stimulation of the pain receptor like abdominal cavity, cranium, thorax, etc. Now come to the based on where the pain is experienced, like radiating pain, referred pain, inductible pain, neuropathic pain as well as the phantom pain. Now come to the factors affecting pain experience. What is this? First is ethnic and cultural values, developmental stage, environmental and support people, past pain experience, anxiety, stress and meaning of pain. What is the assessment? Wrong Becker facial pain scale, simple descriptive pain scale, numerical pain sensitivity scale as well as visual analog scale. If you want to know detail, then you have to go to the application and you have to listen the classes, then only you will get a proper depth idea. Now come to the pain management. First is injection means painkiller, massage, hot and cold application, acupressure, then relaxations, then hypnosis, nutrition, exercise, positive attitude as well as the contralateral stimulation. So how you have to do, what you need to do and what are the things we have to go for this particular management, everything is discussed in class completely in our application. Now come to the urinary continence. So it's nothing but it's the involuntary urination or the leakage. So in this stress incontinence, whenever you are lifting, heavy lifting or any other work, so that time it's urine leakage should be there. Arch continence means you can't hold the urine. Overflow in the sense like when the bladder should be full completely, so that time it will leakage automatically. Reflex means whenever you are doing some work, so or reflection, so that time only it will be leakage. Incontinence after trauma means after trauma like it will be continuously overflowing. And then functional incontinence means nervous system disorder. So what is the assessment? Like urine flow study, 24 hours urine collection, residual urine, voiding pressure flow study as well as the urodynamics. It is a completely combinations of a X-ray as well as a video dynamics, so where we can see the flow rate, pressure rate as well as what is the filling rate and then empty timing. Okay, so now come to the management. First stress incontinence, pelvic floor muscle exercise, weight loss, then cessation of the smoking, external condom catheter and correcting underlying causes. Now come to the arch incontinence, treatment of a underlying cause, behavioral intervention which is including bladder retaining with the arch suppressions, decreased dietary irritants, then anticholinergic, external condom catheter, pelvic floor muscle exercise. Now come to the overflow. So for the urinary catheterization, intermittent catheter and surgery for correcting the underlying problem. And for the reflex, the bladder decompression for preventive urinary reflex as well as the hydronephrosis, intermittent self-catheterization, surgery for correcting the causes. Incontinence means surgery for the correcting fistula, urinary diversion, external condom catheter, penile cramp as well as surgical splenectomy. Now come to the thermodynamics, is nothing but how the body will be reaction for the drugs. So drugs order, standing order, one time, PRN means when required or necessary, as well as stat means at once or immediately as an emergency. And salad means sound alike, look alike drugs only we have to prescribe. So what is the medication error? Sometimes action is intended but not performed. Errors when the smoothing is through the ignorance or by the mistake. So what is the nursing implication? So before giving the medicine, we have to check the medication complete and legible, know why the client is receiving the medicine, and drug level we have to check 3 times
times and know the start date, when the drug was ordered and what is the ending date. So these are the principles for the drug administration: right medicine, right dose, right time, right route, right patient, right to educate, right documentation, right to reviews, right assessment, and right evaluation. So total 10 rights of the drug administration. So now come to the drug forms. Oral form means tablet, chewable tablet, then capsule, etc. Then dental cones, etc. Now come to the liquid form, so means oral solution, oral emulsion, oral suspension, syrup, etc. Now come to the topical forms, means ointments, cream, gels, etc., lotions. And now come to the rectal forms, means suppository or the enema. So now come to the first aid. So first aid is nothing but it is a very initial, quick and temporary care given for the victim during any accident. So according to the American College of Emergency Physician, the first aid manual, first aid is the initial assistance or the treatment given to a person who is injured or suddenly becomes ill. So basic principle, we have to safe response in crisis situation, minimize further injury, use the sustainable technique and first aid procedure, move the victim carefully and reassure the instruct the victim. So what is the aims of first aid management? Life preservation, protection of victim, pain relief, prevent or control or worsening the conditions of a patient, as well as provide the psychological support and reassure. First aid kit, it is a very much important tool where we need to carry everywhere during the emergency situations. Sometimes it is available in the home, school, occupational places, buses, cars, etc. So see the cotton roll, dressing pad, triangular bandage, roller bandage, pain of tweezers, batch of safety pin, then different scissors, adhesive tape, sponge, tongue depressors, splints, matchbox, thermometer, Macintosh, clean sheet, then kidney tray, torch, small note tip, pencil, soap, airway, then rubber catheter, as well as tourniquet, petroleum jelly tube as antiseptic solutions, baking soda, salt, potassium permanganate, then medicine dropper, solutions such as Dettol, Savlon, any antiseptic solution, BP apparatus, stethoscope, glucose and sweet candy or sugar. Okay, so these all are the first aid kit for as a basic. Now first aid management for emergency condition. First is wound. It is a nothing but disruption or the breakage. So there are several wounds is there, like open wound when the skin integrity is broken and injury occurs like knife cut. Now come to the closest, means injury occurs into the underlying tissues but due to the blow or the punching. Now come to the clean wound. It is the one which has no infection. It has tendency to heal quickly. And contaminated means it is the inflammation or infection is there. And abrasion is nothing but where scraping force or the sliding fall, like fall from the motorbike, not deep or may not bleed profusely but painful and may contain for sometimes long. Okay, now come to the incision or the incision wound, which is caused by the sharp instrument or the articles like knife or blade, etc. Now come to the laceration wound, which is messy crushing force like a claw of animal. And now come to the bruises, which is wound caused by blunt force like a blow or punch, and capillaries bleed under the skin and skin's discoloration occur. Puncture wound is nothing but it's a sharp object mainly through the stabbing like a knife stab, etc., which is small entry point but they are deep and painful. Now come to the amputation, loss of the body part like limb, fingertip or finger, etc. Now come to the principles. First stop is the bleeding, then prevent the infection and prevent from the shock. Now come to the first aid for the shock. Firstly, we have to reassure the victim, provide the comfort position, elevate the foot and side to improve the blood supply to the heart and reduce the blood flow to the extremities. Then in case of the head injury, you have to reduce the pressure by the rising head slightly. If the breathing problem then we observe, then we have to raise their head and shoulder by providing the comfortable position. Then we have to lose the tight clothing around neck, chest and waist, which is helpful in the circulation and assist in breathing. And we have to provide the proper blanket to victim to keep the body warm. Then we have to stop the bleeding by pressure and immobilize fracture to treat the cause of shock. Then you have to check the pulse, respiration and level of consciousness. If the pulse and breathing stop, then immediately establish the airway. We have to start the resuscitation as possible. Keep the victim in recovery position. Then we have to transport as nearest hospital. So specific nursing consideration is nothing but DRSABCD. So first is danger. Firstly, ensure the area. Then R means response. So we have to check the response for the victim. S means seek for help. Then A means airway, open the mouth. Then B means breathing. Check for the breathing by looking, listening, etc. And C means CPR, start CPR, 30 chest compression, which should be give the 2 breath, means 30:2 the compression. Then D means defibrillation. Okay. Now come to the first aid for the fractured patient. What is the pathophysiology? First we have to reassure the patient. Then we have to control any hemorrhage or bleeding. We have to use the sterile dressing. Then immobilize the injured part, we have to use the ice pack, which should be wrapped in cloth or towel if available. Then we have to treat the person for shock if it is predictable, and transport the person for nearby hospital as soon as possible. So in this session, I discussed so many important topics in the nursing foundation as well as the first aid, and many more conditions is there which is much more important. Okay, so if you want to study very deeply, just go to the applications which you can download from the Play Store as well as the App Store and crack your exam with a very good score. So thank you. If you want to be updated and if you want to get more update from the health information, then you have to stay tuned with the Easy Nurse. So thank you and enjoy your day. Thank you.